Good afternoon, everyone. Thanks so much for joining us today. We've got a great show for you with new techniques to treat fibroids, a new app designed by a couple of guys at Augusta University to measure what's happening to our necks and spines thanks to smartphones and other devices that have us looking down all the time. And Michael Stewart will be here with tips to decorate your home for the season. And speaking of the season, I want to share something with you. I had a little surprise on my desk today, right before we were doing this show. So I come out into the newsroom and there's a bag with this note attached to it, honoring the memory of a little baby who was born and died last December. It's called Hilton's Legacy, and inside my bag was a beautiful ornament from the Augusta training shop. This is one Adrian made. The idea is to do a random act of kindness in honor of this little baby, Hilton. I hope you'll go to my Facebook page and check it out. There'll be pictures there and more information about how you can do hashtag Hilton's Legacy as well. But first up today, we want to take a look at an important women's health issue. Fibroids, or benign uterine tumors, affect up to half of women under age 50. A new technique needs just a few small incisions in the abdomen. A study at the Medical College of Georgia has compared the relative cost, benefits, and complications of three minimally invasive techniques. And one of the principal investigators on that study is with us today, Dr. Kelly Braun.
So we're currently doing a study. We're one of 10 places in the United States that's able to offer this study. And these are for women who are premenopausal, so who haven't gone through menopause yet, and are suffering from fibroids. So either have heavy bleeding, pressure, pain, and these are women who want to preserve their uterus, so they don't want to go through a major surgery like a hysterectomy.
Okay.
And so we're able to offer three uterine sparing techniques to be able to give them a quicker recovery time without having to undergo that.
So explain the three techniques.
So the three techniques are two are the most traditional. One is a surgical procedure called a myomectomy, where we can do it either through a larger open incision, somewhat similar to a C-section scar.
Is that what you'd call like a bikini incision?
A bikini cut. We could do a bikini cut. Sometimes it may need to be a larger incision up and down on the belly, depending on how large the tumors are. And what that procedure is called a myomectomy. We make an incision on the uterus and shell the fibroid out to remove the bulk of the tumor, close the uterus back up through incisions, and then close the abdomen. Depending on the surgeon's comfort level, this can either be done through the larger incisions or through laparoscopic or camera surgery.
The laparoscopic surgery, which I have had, is amazing because you have just such a tiny little incision and you're back at work so fast.
So that's one of the benefits of doing one of these uterine sparing techniques, is that you don't have to have the traditional 4 to 6 weeks off that you would have from a regular hysterectomy.
Right.
The other alternative is something that's done with our interventional radiologist. It's called a uterine artery embolization. So the uterus and fibroids have particular blood supply, and those radiologists can identify the blood supply to those fibroids, inject them where it essentially kills the blood supply to the fibroid, and it starts to shrink over time.
Because if you're killing the blood supply, it's not nourishing it and making it grow.
Correct. So it doesn't remove it completely, but it makes it about 50% smaller in size, and then decreases the amount of time before the woman has to go back to work.
Now, I noticed that when we said fibroids, are all of them benign tumors, or can some fibroids be dangerous?
So the majority of them are benign. Over 95% of them are benign tumors. Ones that we worry more commonly about are ones that are rapidly growing. So if a woman's size or belly size has increased significantly over a short period of time, say 3 to 6 months, those are ones that we become more concerned about, because traditionally
if your belly size increases, Kelly, get me on the table now. That must be what it is. It must be fibroids.
I think I have them too. The other one that I didn't mention is a new procedure that we're able to do now called Accessa. So that is a laparoscopic radiofrequency ablation of fibroids. So that's a big words to say. We put a camera in the belly. We actually put an ultrasound in the belly so we can identify every single fibroid within the uterus that may not be picked up on traditional ultrasound in the office. We can then target them with a little probe that then destroys the blood supply again to the tumor and shrinks it by about 50%.
It's like you're mapping out what you're going to do before you even go in.
So if they come in with symptomatic fibroids, we talk about their symptoms and what's going to be the best choice for them that's going to give them the best result. And so partnership with the patient, they get to decide which one works the best for them. And then we already have a game plan if we decide to do surgery. The nice thing is if we do the Accessa procedure where we put the camera in the belly, we're able to actually find more fibroids than we could potentially have done even in the office setting.
My goodness. Well, if you are someone who is struggling with fibroids, we have information for how you can contact Kelly on the Jennie page. Just go to our website, WJBF.com, click the Jennie link, and you'll find it all there. Dr. Kelly Braun, thanks so much for your time.
Thank you so much.
Up next on Jennie, using smartphones and tablets can cause posture problems and lead to disorders in the neck, shoulders, even your hands. Now, 2 local experts are using technology to fight a problem caused by technology. The Posture Perfect app, after the break.